I'm Larry Burd. I'm a professor in the Department of Pediatrics at the University of North Dakota School of Medicine, and I'm the director of the North Dakota Fetal Alcohol Syndrome Center. I want to thank the National Organization on Fetal Alcohol Syndrome and the National Disability Rights Network for this opportunity to talk with you today about fetal alcohol spectrum disorders, what we used to know as fetal alcohol syndrome and fetal alcohol effect. Typically, the way we think about this now is that when a pregnant woman drinks, alcohol goes from her body across the placenta into the fetus. And the primary impairment from that is that when alcohol crosses the placenta into the fetus, it causes cell loss in the brain. So every time you drink, alcohol enters the fetus, causing cell loss in the brain, producing cumulative brain damage over the course of these drinking episodes. So if you drink on Fridays and Saturdays for a 40-week pregnancy, that's 80 episodes of this, and that can result in a great deal of impairment for a newborn child. I think a very useful concept in talking about this is to consider that what we used to think of as mostly behavior associated with fetal alcohol spectrum disorders, we should now consider more as impairment. So impairment is vision loss, hearing loss, motor coordination difficulties, difficulties with memory, expressive language, comprehension, attention deficit hyperactivity disorder. These typically last for a long time, are not voluntary manifestations of this problem by the child or affected person. So for the rest of our time thinking about this, let's keep in mind that when we're describing behavior in fetal alcohol spectrum disorders, what we're actually thinking about is impairment that is a result of brain damage and dysfunction caused by drinking during pregnancy. What is fetal alcohol spectrum disorder? Well, first, the unifying concept across all the different diagnostic categories is brain damage or dysfunction. And this usually looks like developmental delays, problems with speech and language, decision making, tremendous risk for the development of substance abuse in adolescence or adult life, a propensity for development of mental health disorders. And I think a useful way to conceptualize fetal alcohol spectrum disorders is to look at the developmental trajectory. And typically what we see is that you do not outgrow FASD. It tends to get worse over time. And the mechanism by which the severity increases is that you just have an increasing number of disorders as you get older and older and older. For example, a 2-year-old, very low risk for drug dependency or substance abuse. A 17 or 18-year-old, the risk is extremely high. I think it goes without saying that people who say, what good does it do to diagnose FASD? We're already doing everything we can, really don't understand this disorder. That's an extraordinarily naive statement. I think when you have a diagnosis of FASD at any age, the first thing that happens is you have to look forward in time and ask yourself, what problems come up? Well, you're at risk for abuse, neglect, foster home placement, educational difficulties, the development of multiple developmental disabilities, substance abuse, you're at a huge increase in risk for dying. So all of these things are susceptible to management if we have a thoughtful caretaker or a thoughtful team managing these children. Lastly, I'll just spend a second on this issue of diagnosis. I'm not going to spend much time on fetal alcohol syndrome, the children with the facial features, growth impairments, brain dysfunction, because they're uncommon. By far the most common manifestation of fetal alcohol spectrum disorders are alcohol-related neurodevelopmental disorders. Most people are surprised to find out that for a long time we've had prevalence rates for FASD of 1%. That means that every year about 40,000 new cases are born in the United States. Some more recent prevalence data is much higher, suggesting it might be as high as 3% or possibly even higher. At 3%, think about this, that's 120,000 new cases a year. That means that in the first 20 years of age cohorts, we have a couple of million affected people with FASD. Huge numbers of people. Where do these guys show up? I think it's pretty straightforward. Special education. There's a lot of kids in special education. The real mother lode of fetal alcohol spectrum disorder is foster care, where perhaps as many as 50 or 60% of all children in those systems of care either have an FASD or the risk is so high that they need a diagnostic evaluation to sort this out. Juvenile justice, the correction system, birth defects clinics, huge rates of FASD in those settings. I'm a strong proponent of using a diagnostic checklist for an alcohol-related neurodevelopmental disorder. If you have a score above the cutoff, you simply manage these people going forward as though they had an FASD. There may be some where the issues are so crucial we want to refer them on for an assessment, but in most cases, no state has adequate infrastructure to manage the tens of thousands of undiagnosed cases of FASD in the child, adolescent, and young adult population. In the prisons alone, we couldn't possibly build diagnostic capacity to do multidisciplinary evaluations for all of those people. So, going to a simple diagnostic checklist, making the relationship between prenatal alcohol exposure, this set of problems, and managing them going forward in time as though they had an FASD. Very promising strategy, and one which I strongly endorse. 85–90% of the cases simply have brain damage. They don't have the facial features, they don't have the growth impairment. And so when we think about this brain damage, our first thought is these people are misbehaving, as I mentioned earlier. As we begin to get more knowledgeable about this, we're going to construe that not as behavior, but very much as impairments. They're having temper tantrums because they don't understand us. They're having frequent contact with law enforcement because they're impulsive, they're being victimized by their peers, they have a multitude of problems like that. What's the life course for FASD? As I mentioned, it gets worse over time. This goes on well into your 20s, possibly even into your 30s. The way severity increases by increasing number of problems. You start off with sleep problems, feeding problems, that becomes temper tantrums, speech and language problems with sleep problems. That goes on to become that stuff plus ADHD, plus academic problems, plus aggression. And the number of these problems just continues to cumulatively rise over time. Lastly, I want to just talk briefly about the implications of FASD in the justice system. And imagine a scale, and on one side is a fetus who's being exposed to drugs, alcohol, smoking, poor nutrition, and has brain damage. That same fetus then becomes an adolescent or a young adult who has an anatomically abnormal brain, a functionally impaired brain, and we're telling that person, we want you to get over this. You have to be responsible for yourself. Very useful court case, and the justices said that they could imagine few things more beyond one's responsibility than the drinking habits of your parents prior to your birth. And I think that sort of sums it up. These folks are born with these problems. They're trying to live with them. To the extent that we don't understand them, we don't help, we complicate that problem. To the extent that they have a diagnosis, we understand the developmental trajectory of fetal alcohol spectrum disorders going forward. We greatly enhance the quality of their life, the effectiveness of services, and we decrease dramatically the number of problems that they're going to have. Over the past month or so, I've had several conversations with panels of judges about FASD. And both times, these are senior judges, several of them with a significant amount of experience. They have indicated to me that they have never had a case show up before them where FASD was mentioned. So obviously in family law, criminal law, corrections systems for juveniles, we are missing huge numbers of affected people. In general, I think it's fair to say that most of the places I go around the United States, less than 1% of the people with FASD are diagnosed. Very rarely do you find a setting where 5% are diagnosed. So if in your work you now begin to see large numbers of people who appear to meet criteria for FASD, you should be reassured by that this is in fact correct. I think it's important to emphasize there's no known safe levels of drinking. You should abstain from alcohol use during pregnancy. If you have been drinking, find out you're pregnant, you should quit. I get a lot of referrals from people who say we want an assessment to determine if this is FASD or attention deficit hyperactivity disorder. Is this FASD or reactive attachment disorder? This represents in most cases a fundamental misunderstanding because it's usually not either, it's often all of those things. So you can have FASD in vision problems, you can have FASD in heart defects, you can have FASD in depression, you can have FASD in anxiety, you can have FASD in sleep problems, you can have FASD in all these things. So rather than FASD or, it's usually FASD and what other problems are present. Much more useful referral question when you're sending people to us or other centers for them to be seen. I think it's also worth discussing the implications of fetal alcohol spectrum disorders in two commonly encountered service systems for people from protection and advocacy. First is the corrections system. Lana Popova in Canada published a paper showing that adolescents with fetal alcohol spectrum disorders were 19 times more likely to be incarcerated than those adolescents who do not have fetal alcohol spectrum disorders. However, even this rate seems to underestimate the magnitude of this problem. In a past study in the United States and Canada, we looked at each state's correction system, asking them to report to us the number of people with FASD who were diagnosed. It was an astoundingly low number. For the United States, less than 50, about the same for Canada. So there are literally thousands of people with FASD in the adult and juvenile corrections system who are undiagnosed. This has important implications for the entire legal process, beginning with the first part of working your way through the court system, has very substantial implications for development of services, including parole and probation, where people with FASD simply may not be able to follow routine parole and probation recommendations and need modifications of those. A second area where fetal alcohol spectrum disorders is very commonly encountered is the foster care system. This may be the system where people with FASD are the most concentrated. Prevalence is extremely high, and any child in foster care should be considered as very high risk for having FASD. This makes a great deal of difference for these children in placing them in foster homes. And very often it's children with FASD who have these remarkable numbers of foster home placements, 10, 15, 20, 30 different foster homes. I think if people recognize that these folks have FASD at the beginning, place them in a foster care setting where there's access to a lot of services, respite care, well-trained foster parents, we could reduce the number of these subsequent foster care placements, which are so debilitating for children and really contribute to the rates of secondary disability for them. What we suggest, what we do in those settings, is we have a maternal risk score, which in our studies has been shown to differentiate women who drank enough to have a child with FASD from women who did not. So in the absence of the mom and her ability to report, we use the maternal risk score. So for virtually all children adopted from foreign countries, you're virtually, at least in our experience, never going to have access to the mother. So we always complete a maternal risk score for them. In protection and advocacy, I think a couple of other issues related to fetal alcohol spectrum disorders occurs. One is how do you find an expert? And so very often you're having a dilemma of somebody who's in a time-sensitive placement. They're in corrections, they're in jail, the child's in foster care, the mom's trying to get her children back from foster care, and you need an assessment. In many of these settings, it's just simply unreasonable to look for the Cadillac form of assessment, a multidisciplinary team with a medical doctor who has expertise in fetal alcohol spectrum disorder and a neuropsychologist to do a 1 day or 2 day evaluation of somebody and produce a highly detailed report for you. So I think a useful strategy is to see whether or not it might be satisfactory to complete this checklist for an alcohol-related neurodevelopmental disorder. If a person scores above the cutoff, can you find supporting documentation for that? We almost always are concerned about issues in 4 areas. One is a cognitive evaluation, typically fairly straightforward to get. Almost every community has access to a psychologist who can do IQ testing. Those psychologists can also complete adaptive behavior testing. By far we prefer the Vineland adaptive behavior scales, and then we contrast those to see if people have impairments in their daily living skills. We consider most of these evaluations incomplete without a routine assessment for attention deficit hyperactivity disorder, which affects about 50% of people with FASD. Our experience also suggests that virtually 2/3 or more of people with FASD have comprehension problems, both in reading comprehension and in oral comprehension. So we consider those 4 areas keys to the assessment process. Much of that data can be obtained locally, and if you don't have people who can do that very often, you'll be able to find that data in a routine review of the record. I think it's very useful to consider contacting Fasd, National Organization on Fetal Alcohol Syndrome. They have an information clearinghouse with a wide range of experts in many areas related to fetal alcohol spectrum disorders. So that'd be a very useful resource to see if there's somebody with expertise and experience close. Perhaps most importantly, most helpful, is to recognize that most people with FASD are going to have a decreased capacity for independent living. If they're going to live as independently as possible, they're going to have some extra help. A prominent researcher in this field called that an external brain, and I think that's quite right. The people with FASD who are the most successful almost always have that external brain. Sometimes family, friends, a brother or sister, a life partner, but somebody who helps with long-term judgment. All the correction systems, from juvenile corrections through the adult corrections, women's corrections programs, all dramatically under ascertain FASD. So it's very likely that 1 or 2% of the people who have FASD in those settings are diagnosed. This has profound implications for people trying to participate in their defense. This has profound implications for people who are on parole or in other complicating settings, because their fetal alcohol spectrum disorder, the component parts of that, make negotiating all those things difficult. These long, complicated forms, they read, they don't understand. Long directions, they listen to, they nod their head, they say yes, but they don't understand. Repeated procedures are a particular weakness of people with FASD. So needing to show up every Wednesday for a check-in with your parole officer is something that's very difficult. And if we just took a minute and we look back in the lives of these people when they were 2, 4, 6, 10, 12, 14, we can see that they have always had difficulty with this same set of problems. So it should come as no surprise to us that they have those problems now. It's mostly undiagnosed. It's mostly alcohol-related neurodevelopmental disorders. It's mostly brain damage. It's mostly impairment. It's going to be mostly lifelong. It's going to require very long-term services. Anticipatory management is the key. That's the key to success in FASD.